Hey, it's Melanie Petro. I'm going to hopefully get to show y'all some cheeks today, and really it's about shadows. So I have a patient here that feels like she's got too much volume right here, and she wants a lift, not something surgical. She's not interested in that at this point. So what else can we do? And we get asked that a whole lot. This skin can be lifted by adding volume to the cheek, and Chloe actually just sent me a great image that I'm going to post in a minute so you can see how that happens. It's the shadows though. I mean, when this particular person's like, I usually don't take selfies, but she just had a grandbaby and some people have been taking her picture, and when you start to take selfies, you can't quite, it's always lighting, as Chloe will certainly tell you, it's always lighting, but it's the shadows that you see. So if you see, like, people with bigger necks will see it, how their neck looks dark right here because they're seeing the shadow. In the cheek, you can start to see this right here, and this is the perfect, it's not flattering, but it's the perfect way to show you. So I'm going to try to show you. You can see a shadow here. When you turn different ways, this looks hollow. One of the best ways to fix that, if you don't need something directly in your eye, you can add some voluma here, and it helps lift this up. So if you're looking at a picture, I think black and white's a good way to see it, and you see something that looks dark right there, you can see it over here. It's shadows. So when you lift this up with a little bit of voluma, the shadow goes away, and that's really what voluma does. I was lucky enough to master train with the most amazing voluma injector ever, and he pulls the cheek and then injects, and it just takes very small amounts, and it's something that you can see instantly. So I'm hoping she's going to let us see that, because it's really like a lift without a lift, and it's just perfect. I think the black and white's a good way to see it. We have some posts on Snapchat too. If y'all don't follow us there, I do that more because they have more filters. See that shadow? I can eliminate that with a little bit of voluma. That's actually probably the edge of a cheek implant that I have to cover. I don't like facial implants anymore, because if you use them and you age funny. Same thing happens around the chin. And I don't have a chin implant, but when I look like I did right there, when you have a chin implant, it kind of sticks out, and then on the side you'll see the skin age around it. Cheek implants are a little bit better, but you still find yourself having to hide it by adding volume. So hopefully she'll let y'all see, and I would love to show you, because cheeks are just an easy, fun way to look younger, especially after you have kids. If you're thin, you just lose volume in your face. I mean, you can get it back, but you'd have to get fat. Nobody wants to gain a bunch of weight just to get volume in your face, because, you know, well, we all know why. But you can't always predict where you're going to get it. But a lot of people that lose a lot of weight say, I feel like I look so much older. I mean, even 5 pounds once you get over 40. I mean, it's just, your face tends to really go away, and, you know, you tend to see the eyes. It never goes away from your neck for some reason, just your face. But we'll show you the cheeks, I hope. If not, I will show you on me, because I'm going to, after looking at all this, I'm going to have to do some in a little bit. But hopefully she'll let us show you. If not, we'll find another way to show you. But cheeks, we don't talk enough about them, and it's so important. It makes such a great difference in getting your face elevated, especially from here, very quickly. Like one syringe on one side and you can tell, and it's just the way you age, it deflates. So I'll be posting that picture. If y'all have any questions, let me know, and hopefully I'll get to show you some cheek augmentation.